So today I will be explaining PPE steps. First thing you do is wash your hands before you enter the room. So I'm washing my hands. Second thing you do is get all your equipment together. We need our cap. We need our gown. We need our mask, sterile gloves, and that's it. The first thing you do after you wash your hands and you enter the patient's room is put on your PPE clothing. The first thing you put on is your cap. Make sure your hair is inside of the cap. The second thing you do is put on your gown. When you open your gown, make sure if it's too small, you can wear two. The third thing you put on is your mask. Make sure that the hard part is inside and the wire part is on your nose. Pinch your nose to make sure that there's no airway in the top there. Now, the fourth thing that you do is put on your goggle or mask, whichever one you are required to wear.
Now I'm going to demonstrate putting on sterile gloves. First, have a clean, flat surface, then perform proper hand hygiene. Open the package, separating it evenly. Making sure the packaging is facing up, and open it up, making sure both sides on the correct side. The left side gloves on the left, right side on the right. Okay, and you're probably going to start opening up softly, making sure to open the package completely without touching the inside of the sterile field inside the gloves. Okay, then you can use your non-dominant hand to grab the inside of the cuff with your thumb and your index fingers, and then you're going to use it to put it on your dominant hand. Okay, after that, you're going to put your hand inside the cuffing inside of the gloves so that you won't lose any of the sterilization of the glove. And place your other hand inside without the gloves touching any of your skin. Okay, if you have any issues on putting on the glove, it's not a problem. After you put on your gloves, you can just fix your gloves since they're both sterile. Okay, so make sure you can go touch glove to glove. You cannot touch, as long as you don't touch any skin. Make sure after that you just use your fingers to make sure it's all good, and then you just keep it in this position until you're ready to perform any procedure you're going to do.
And now to demonstrate a sterile field. Some of the most important things to remember when doing a sterile field is to drop the supplies onto the middle of the sterile field. Never touch within an inch of the sterile field. Never move your hands below waist level, and never turn your back to a sterile field.
Okay, I'm going to create a sterile field to do a sterile procedure. You can only touch the edges without crossing over. Anything more than an inch into the sterile field is considered contaminated. You're going to do the edge towards you last and the front and the edges first.